everyone. Thank you so much for joining us. This is Civitas Networks for Health, and this is one of our member-led webinars. We are so excited to be here today with InterSystems. They are going to be talking about advancing consent management and interoperability to support care across the continuum, which we know is a critically important topic to many Civitas members. And, really our challenges in interoperability, data sharing, many of which start when we think about consent. And so we're going to hear a lot more about why this is so important in just a few moments, but I have some updates that I'm going to share first. At the Civitas Annual Conference, we are going to be hosting a consent management workshop. There's two sessions. There's going to be a session on Tuesday morning before we officially kick off. So Lisa and the Civitas leadership team will be doing our official kickoff at 11 a.m., but the consent management workshop starts at 8 a.m. This is in partnership with the Stewards of Change Institute, as well as many other Civitas members that are deeply committed to evolving consent management. And so wanted to just give a shout out to this session. There's also going to be a follow-on session on Thursday, October 17th at 11:30 a.m. Now, Kirk and Greg, I believe you all are planning to participate and have some more to share. So I'll turn it over to you, and then you can jump into your presentation from here. And thanks again for joining us.
Talking about the workshop itself. Yeah, overviews. So InterSystems has been working with Stewards of Change Institute since probably March of this year. We started at HIEs. And there was a report from a session that was created around consent that's just about ready for publishing, and we're going to share it with the Civitas Networks for Health community as well. InterSystems has been working in and around consent matters for a little more than a year. We had an existing relationship with the folks at the Stewards of Change Institute. They were looking for some active sponsorship and some participation. Greg and I both worked in state and federal government, respectively, for a number of years, and we work in and around vulnerable populations. So when we think about consent in general, and the reason we're having the session today, InterSystems doesn't have a consent solution. Today is not a commercial. This is an attorney and a tech guy who's been involved in HHS related technology and policy for a couple of decades, coming together to have a conversation about a matter that we think is important, because when you deal with vulnerable populations, it's scary for them to enter a system, to apply for benefits, and to start thinking about the relationship between the things they're consenting for and what happens to them afterwards. And I think we have a responsibility as a community, regardless of the lens that we support, to actively make sure that the people that are most in need have access to services that are there. So today is really a little bit of a riff on that. All right, next slide, please. All right.
Go to the next slide. I think we covered what we can say during this.
All right, so we're going to have a couple of items we want to go over today. We're going to start with some consent concepts to try to ground the conversation a bit. Then we'll talk a little about interoperability from our perspective and some implications around it. And we see consent as an active and evolving set of activities. Greg and I and the Stewards of Change Institute talk about it in that construct fairly often. So we'll have a little bit of food for thought around that kind of stuff. So next slide. All right, Greg, you want to start?
Sure. So when we think about care coordination and data privacy, it really, we need data shared. If we're going to provide effective services, that data needs to be shared at multiple levels, right? There's obviously the direct provision of services. They need the information handed off from one program or provider to another. But then when you move up to a program administration level, to understand how your program is operating, you need data. When you're looking at compliance, you need to work at having that data. And then at a community level, for understanding are the programs we're funding and the solutions we're trying to pursue and the strategies we're pursuing, are they effective? Are we actually delivering the services we want to deliver? And are we moving the needle in the direction we want it to move to try and solve some of these most challenging problems? So we really look at this as a multifaceted problem of where we need the data to be.
Right. I think that for the purpose of today's conversation, when we hear the word data, there's data within the system, right? And what we're really sharing above it at the program level is information and content, right? So how does all of that come together? And oftentimes we'll have a conversation at a data level, which kind of puts it in a position where it seems sort of cleansed and sterile. But really what we're talking about is how does information get passed back and forth that impacts people's lives? Yes, and we will have slides available for everybody after the webinar. So next, please.
Sure. So when we think about it today, there is more data being collected from and generated about patients and clients. And I'll use those terms interchangeably because if you're in the medical context, we think about patients. Those same people are clients to the human services world where I come from. More data being collected and generated about them than ever before. And we need all that data if we're going to tackle these most complex problems like social determinants of health or environmental justice or just effective delivery in solving seemingly simple problems. It is easier and faster to share data than it ever has been before. But paradoxically, it becomes more complex because the more data you're sharing about somebody, the more data you also need to be collecting about those interactions so that you can make sure that you're sharing the right data with the right people in the right way for the right purposes. So for today's purposes, we're really focused on data sharing for care coordination and the delivery of social services, that sort of non-clinical, non-treatment data exchanges. But most of this holds true in the medical context as well.
And I think of 2 quick points. First is when you add human services to the construct of healthcare, understand that there are probably 47, 53, some number of programs that agencies are moving forward. So that web that you see on the right gets really wide quickly. And it also starts to stack because there's a lot of differences in understandings, right, about what is contained within that content and that data about individuals and how they're going to interact with the program and for how long and things like that. So next slide, please.
Right. So within our system and our society today, there's this fundamental tension that exists, right? So on the one hand, everybody wants the data to be shared. Individuals don't want to have to fill out the same form every time they go to a different doctor's office or a different provider. They don't want to have to repeat their story and re-experience their trauma every time they go to a different state agency. And, you know, legislators and policymakers are expecting that we understand what's going on in the community and that we have all this information that they know is out there. Balanced against that, though, is this genuine concern for protecting privacy and giving individuals control and autonomy over their data, right? So that's reflected in laws like HIPAA, FERPA, FACRA, and we can go on with the alphabet soup there, but there is this tension between keeping everything private and allowing control and sharing the information.
Yeah. And I think that, you know, last when we talk about data in this construct, what we're really considering and thoughtfully considering is the relationship between that information about a person and how it serves as a proxy within the system in their engagement with programs, right? Therefore, when we think of protecting data or we think about purpose of use and who has rights and under what scenarios, right? We should be thinking about that in the same regard, in the same level of care as we would if that person was actually in the room receiving services, right? So the data as a person, because what we find out practically are there real life consequences when privacy is breached or when a sort of consent isn't provided. And there are a number of historical cases where trust has been violated around consent, and whether it's intentional or unintentional, the result remains the same. And I think as program officials and as people who are serving within this ecosystem, we should never forget that these are people involved. It's not just data. The data represents something else.
Right. So at the end of the day, then, consent becomes a mechanism for balancing these competing priorities, right? So it is giving the individual the ability to have their data shared, and yet still allowing the programs to be in compliance with these privacy regulations and control. So next slide, please. So ultimately, as we think about solving issues of consent and interoperability, we really need to think about this on multiple levels, right? This is not simply a technology problem. This is also a programmatic issue of how the business processes are put in place and how individuals are going to engage with the data. The data systems then reflect what the programs, policies, and business processes are. But this is also then a policy level challenge, right? What are the rules and regulations around consent and data privacy, and what are the data standards that are implemented by it, right? So it's not just policy as laws and regulations, but it's also policy as standards and policy as practice within a program.
And I think that it's manifests itself at the technology level, how you think about consent in relationship to workflow, how you think about storage of content, how you might report, how you might want to have technical audits about transactions and things like that are taking place, and how you have validity within that technical framework.
Right. So the reason you have a technologist and a policy person here is because this is really a union of both of those. So next slide, please.
So when we think about consent, broadly, this slide tries to capture a number of terms of art around consent. Generally, when we have conversations around consent, a lot of this historically started from a medical standpoint. We're applying some of these concepts to human services and social need. And again, the convergence of both the health and the human services stuff that kind of comes together, especially when you think of concepts about food as medicine and things like that, really ties together around a social needs framework. So when we think about consent in that sort of broader context, somebody makes an individual expression or an approval, given permission for some other person to act on their behalf, right? And generally what you want to make sure is that people are being informed about what's going to happen, that it's free from coercion, and that people have sufficient capacity. Here we talk about mental capacity, but there's also an aspect of cultural competency that I think comes into play to it. There are literacy issues that come into play. There are a lot of things about, people who newly immigrate to an area that aren't familiar with the construct of social programs, maybe in the same way as their home country or where they came from before. And this concept of being free from coercion, I think, is really important, because when people are applying for public benefits and programs, there's this delicate balance, especially when you look at the human services side of the house, about where coercion might start, whether it's intentional or not, because it's at this point of consent that people are most vulnerable to enter the gateway or enter the system. Therefore, when we think about the informed consent process, what we're really trying to do is make sure that people have an understanding about what's going to happen to the data about them during the procedure. Are there going to be some sharing that takes place? Is an IRB involved? Are there research purposes around to move forward? Making sure that people are informed in the context is really important, because then we start to migrate over towards consent to share types of things. and it's pretty specific about how content is going to be shared for the coordination and delivery of services, whether we're talking about medical or non-medical services. So that can be everything from food assistance, transportation. We talk about a 360-degree view, or some of our friends at Human Services that might talk about wraparound services, or we think about something like food as medicine as a concept, right? That's really pulling together lots of different points of views from different social and medical constructs to try to address a problem about an individual who might have diabetes or something like that. Anything? Nope. All right, next slide, please. All right, so when we talk about the principles of consent, wrapped around that, what we want to make sure is that there's autonomy, dignity, and respect and ethics, right? So I don't want to sound like I'm on a high horse about anything, but I do believe that people applying for benefits, especially in the public realm, as public officials, we have a role and responsibility to offer dignity and respect to those people that we're attempting to serve, because public service, right, and community service is about giving, right? Now there's compliance and there's other activities to move forward. But yeah, if you're not respecting the individual in practice, it says a lot about how they're going to be treated during that regimen, right? Autonomy. People should have the opportunity to opt in and opt out at certain periods of time. They should know the ramifications about the consent, what it means to them, and at points and times where they're uncomfortable, have a chance to at least call for a timeout. And then from an ethics standpoint, we have to be clear about how we're going to use that information and that data about individuals. How are they going to be studied? What's going to happen down the road, right? And these things coming together really, I think, serve as pillars for putting consent into practice, right?
Yeah, so then applying those to the context of consent to share, what that really, from our perspective, what that translates out to being is individuals have a right to know what data is going to be shared, for what purpose, who is sharing that data, or who is requesting that data, who is receiving that data, who will be viewing that data, and then ultimately, what are their rights to modify or revoke their consent. And as we think then about our data systems, how are we tracking and monitoring all of those activities and supporting those activities to ensure that we're respecting the autonomy and the dignity and acting in an ethical process. Next slide. It's mine or yours? It's mine. Okay, so what that effectively then means is when we are getting consent from an individual, we need to capture that. It's not enough to just have them say at one point, yeah, I agree, share my data, right? We need to have all of those, what data, with whom, for what purpose, for what period of time, all of that data needs to be captured, right? So our capturing of data needs to be dynamic and it needs to be granular. And it also then needs to be translated into a form that is actionable. So a lot of programs today will have somebody fill out a form online or fill out a form in paper, and they'll have a scanned copy of that, but that data isn't really translated into a format that can then be shared and digested within their data system or other data systems and exchanged so that it can be acted upon by that data system for the purposes of gatekeeping and other things that we'll talk about a little bit later today. If we don't translate it into that kind of format, the data systems don't know what to do with your consent, right? And you can't really implement consent in an effective manner. One of the greatest challenges that we have today is many of our data systems, even if they're capturing consent data in an actionable format, they're doing it based upon what that particular program's definition and spectrum or scope of consent understanding is.
Yeah.
So there is no single global standard for what consent is. And just look at the differences between HIPAA and other consent regimes. And even the most sophisticated consent planning is never going to be able to address all of the consent standards that are out there in the ecosystem, simply because we don't know who we're going to be sharing data with tomorrow.
Right, and when you think about the system construct there, right, a lot of the systems that are currently in force, they weren't built purposely as enterprise systems encompassing all policy around consent or all health and human services programs. As statute or funding became available, a lot of these applications are purpose-built, so they need a specific, more narrowly sort of defined set of parameters. Therefore, when you think about the relationship of consent and the purpose, it's fairly narrowly viewed. So the system reflects the term of the art of that time period, right? And now we have to start thinking about, as this evolves and there's a desire to pull this information and content out and share it in appropriate ways so that we can try to add additional benefit for people across the continuum, that complexity that you talked about earlier and sort of that web really sort of comes into practice, because if you take nothing else away from this, understand the current capture modality of this kind of content is really fractured.
Correct. And that's not a criticism of any of those data systems or any of those programs or providers, right? They are responding to what their mission is specifically at that point in time when they build those systems. That's absolutely the right thing to do. And as a former state official, I would defend that architecture, design, and approach, right? That's where my funding is. That's what I need to respond to. Trying to solve every problem under the sun while I'm building a system, I'm boiling the ocean at that point, and that's not really practical.
Yeah, what we're really talking about now is trying to meet an evolving need with consent as part of that overall picture.
Right. So next slide, please. So we mentioned our work with the Stewards of Change Institute and some of their work, and the white paper that they have that will be coming out very soon. And one of the concepts that they are advancing in that is the notion of a consent management utility, right? So an external system that can be operated as a shared resource that would really provide three functions. One, it would be a library of acceptable consent forms that have already been generated that can be implemented for a variety of different purposes, but have been vetted and are compliant with various legal standards, so that as we come into new data sharing situations, an individual community-based organization or provider or data system isn't trying to reinvent the wheel every time. Stacked with that then is a consent management service. So basically brokering requests from different data systems to say, yes, consent has been approved, or no, it hasn't. And to support that, then as we get individual consents from patients or clients, the consent management utility would store those consents in a secure storage in a manner that allows that information then to be shared with various data systems and implemented by those data systems for their interconnections and data sharing purposes. So is this the only solution to this problem? No, it's a concept and an idea of how we might tackle this, but it really reflects the idea that we are going to need a tool or a variety of tools to try and solve the problems of consent management across various data systems.
That's right. And we talked briefly at the beginning of the presentation about the two workshops that are coming up. I would encourage anybody who is interested in consent policy practice, the utility itself, to reach out about attending one or both of those sessions that we're going to have at the Civitas conference. The next slide, please. So when we think about the relationship between consent and interoperability, there's a practice sort of part of the issue in the practice of the active nature of consent, and then it's interoperability thing. And we saw a little bit of what the Storage Change Institute in their group had split together around this. When we describe consent and we talk about it in-house from a policy standpoint, what we really talk about is consent being a mechanism, right, that opens a gate that can allow content sharing, right? But when you implement that, we talked a little about some of the fragmentation that takes place. When you're dealing with two, and especially the more entities that take place, the more disparate systems you have in place, the bigger and more scaled your interoperability challenge becomes, right? Oftentimes, because stuff is on different platforms, there's different formats, there's different standards that are involved, there's different definitions, right? When you talk about a child or a family, the definition of a family may have a different construct between different public programs. Child welfare and child support oftentimes may not have that. The concept of a custodial parent and a non-custodial parent doesn't necessarily move across the board in every framework that moves, around this.
Or another example, for various public benefit programs, they talk about a household and a household unit, and a benefit unit. How those are defined, is it everybody who's living at that particular address? Is it everybody within a sort of legal biological family that's at that address? Is it just those individuals who are applying for and receiving the benefit at that address? All of those things may be different. So if we're trading data between systems and defining things in different ways, we have an apples and oranges problem.
Right. And that's why context becomes important. And we start to think about layering this stuff on and having consent and sharing content across different program areas or different entities that are involved, and even including external community partners, something to go through. That dynamic process, right, adds another level of complexity, because these aren't just single linear kind of things that are happening. Oftentimes, there's this real brokering in real time that's taking place among lots of parties at lots of times, sometimes about an individual, sometimes about their family construct, right, or their household construct around certain things. And when it comes to somebody consenting for that information, do they really understand the level of complexity they're walking into? Because I think as program officials and people that have been around this kind of stuff for years, we know that it's an emerging art. So how do we translate that back to other people when they're walking in and they want to open the gate because they may be able to receive some benefit from an agency, right? So therefore, we start to think about how to actively manage, curate, govern this framework, right, in a loose enough manner that it can be scaled and elastic, but with a set of standards that it's also auditable and traceable. So some of that's art and some of that's science. Anything else? No. All right, next slide, please.
Right. So as we think about this, moving this from just concept to implementation, right? There are a couple of essential functions associated with consent that systems are going to need to be able to work with. One of them is the obvious, right? The gatekeeping of making sure that I'm only sharing the data with the right people, I'm only sharing the right subset of data with those folks, and that I have the consent in place. And every transaction, you're going to have some of that gatekeeping going on. Less obvious is the audit function, right? And the idea that if I'm going to truly know that I only shared the right data with the right people for the right purposes, and when I had consent, I need to have an ongoing record of all of those data exchanges and the corresponding consent information about them. You might also then have an integrated notification requirement where a client either actively gets notice that their data is being shared with a new counterparty or an existing counterparty, or the ability for a client to come in and say, I'd like to know where my data has been shared. Please show me the record so I can know what counterparties received it, right? Who was told that I was looking for food assistance in this community, and who then received additional information, perhaps about qualifications and eligibility.
And when I think about this from a technology perspective, I start to think, especially when I look at auditing and gatekeeping, right? Making sure there's security and validity around certain things, right? The physical system security that goes along, auditing, what kind of overhead is necessary to manage the audit trails that take place? How are you going to store that kind of stuff? What does your overall data model look like around not just for the consent utility, right, or the consent that takes place itself, but also all of that audit features, and then the notification part of it. How does that tie into your workflow? And how do you create conditions where you know you need to make sure that somebody else is informed about that kind of stuff? All right, next slide, please. All right, so we talk about interoperability, have this concept of interoperability being consent and action. And we tease that around the table here, and also with the folks who participated in the workshops with the Storage Exchange Institute around this. So when we think about consent, we shouldn't think about it as just a one-time paper signature kind of thing. What it really is, it's something that's an active, growing, and evolving process, right? So the interoperability layer is where these kind of challenges get resolved. What's being shared with whom and under what conditions, right? What does that translation look like? Is there a common understanding of consent across the various systems? And what kind of content's being brokered and then further exchanged, right? How are you tracking and auditing this kind of stuff? So this layer of interoperability that takes place, the orchestration and the management of that has to be thoughtfully considered. And there are a number of different ways to do this. Greg's going to talk about those.
Sorry.
The central hub.
That's okay. So when we think about where an interoperability layer might be implemented, there's different models, and we'll see a graphic on the next page, but you could have a central hub that's providing your translations and interoperability. You could have interoperability layers that are built into individual program applications. Or you could have a hybrid of those where some applications for large systems or programs have their interoperability layer, but they're still then communicating with some sort of a central hub or clearinghouse to perform additional translations for those smaller applications that they might want to connect with that don't have their own interoperability layer. So really, the key considerations we want folks to take away from this on that is thinking about the scale and volume that's necessary, the elasticity to address the complexity and the changes and evolutions that are going to occur, and how that interoperability layer is going to be curated, actively managed to evolve and meet the business needs. Because just implementing interoperability once is never going to be enough. You're going to have to constantly go back and re-examine it and make sure that you're staying current with what the standards are, not just today or tomorrow. That also means that we're going to need some standards probably out there to develop a strong common data model around our understanding of consent, as well as these individual program data elements. So that could be HL7 FHIR, it could be something else. What's really critical is we have a common taxonomy and lexicon for how we talk about the terms around consent and package that information between sharing the data sharing systems.
That's right. So the concept of the data model coming in, storing and understanding the scale and elasticity attributes become really important. And here's why. So when you think of the data model itself, across all of the program areas, some of the fragmentation between definitions and understandings are really going to come into play. And it's at the data model level that I think a lot of this stuff gets discussed and managed. The assumptions have to go away because this is the part where you're taking disparate understandings and you're coming to agreement. It's not always an easy process, but to me, this is a place where technology and policy come together, because without the data model being effectively understood, then when the stuff is put into practice, it's not going to operate in the matter as designed, which means the results won't be as defined and the outcomes aren't going to drive toward what you're looking for. And when we think about the data model, if we're going under the premise that public programs are going to evolve, then we have to think about the data model coming back through that active curation and extending it out as member systems within the ecosystem have changes in statute or practice, and making sure there's an understanding about what that means for everybody else in that entirety of the service chain. So it's not enough to build some interoperability framework, right? This is going to be an active, living, breathing, evolving concept, and it has to be managed that way.
And also, like that, just thinking about this, the data model then becomes essential, not just for the technical interoperability, stepping back and thinking about those programs and the policy application implications of this. The data model becomes essential for trust, right? I'm not, as a program officer, I'm not going to be willing to share my data if I don't have faith and confidence that your system is going to handle it the same way that I understand it's going to be handled, right? And so if I have confidence that the consent information I get from you matches my understanding of consent, it's been translated properly, I then have confidence and trust to allow my data to be shared with you, and vice versa. So that's, I think, why the data model and this interoperability becomes so critical in this process, right? It's not just about allowing ones and zeros to flow across a network. It really is about inspiring and allowing program officials the confidence to be able to share the data.
You know, when you think about the data science aspect of things that may go along with it, whether that's for research purposes, compliance, analysis types of activities, program evaluation, that model again becomes the underpinning. Is about what you have the capability to do with content across that ecosystem, right? So next slide.
So, next slide. Great. So I mentioned the graphic of the model. My apologies. Space-wise, we just couldn't fit it on the other page. But this is really, you see the hub there, you see the systems that have an interoperability layer and systems that are perhaps smaller. So, you know, your local food bank is probably never going to have a data system that has a complex interoperability layer, nor should they. It's not where we want them spending their time and resources and energy. We want them delivering food to people. So as we think about all of this, we said at the beginning, we weren't here to sell a product or necessarily to provide answers for how this should all be achieved or done. This is really about starting a conversation and planting some seeds with folks as you think about your systems and the evolution of your data systems. These are considerations that we think you should be incorporating into your planning now, right? So the worst thing that happens is you build a data system with a very rigid consent tool or a very rigid consent implementation, which then cannot evolve and grow with the rest of the ecosystem, the community, and ultimately would have to be scrapped or replaced with something else, right? Now is the time to start thinking about how are we going to approach this solution, and what does that It means having a data model that is granular and elastic and extensible. It means having a tool that's able to deal with a high volume of data, as well as evolve with our changing understandings of who we're going to connect with and how we're going to share data across those systems. And with that, Kirk, any closing thoughts, or you want to jump into questions?
I think we can jump into questions.
Great. So I know.
And it does look like we have a couple of questions in the actual Q&A. So I didn't know if you want to go there first, or if you had a couple questions you were going to ask each other.
No, we have, we're going to try to do some of this cold from what happens, and we respectfully reserve the right to punt. And based on questions, we would also encourage people to come to the sessions that are going to be at the conference, because part of this discussion today was really our attempt to say to a larger community here, hey, this is some stuff we're thinking about. We're working with some other people around it, and we'd love to have Civitas Network for Health members, a larger number come in and join it, because we think it's an important topic.
Absolutely. All right. Well, let's dive in, because there's actually a lot of questions. There's a few in the chat, and then I'm going to go to the Q&A first. So the first question is, well, HIPAA provides guidelines for what type of consent decisions may be needed to support general medical and sensitive health information exchange. What guidance or best practices are available for determining consent decisions for expanded health equity data sets? So that could be social or community health risks and referrals, sexual orientation and gender identity. And should this evolving data set fit into the general medical sensitive health models, or follow its own procedures? It's a good question.
There's a little bit to unpack there.
Yeah, there's a lot.
So you started us with the easy one, Julie.
Yeah, exactly.
So I think ultimately some of this may require looking at legislation if you're going to tackle some of the HIPAA restrictions. But beyond that, what I think is really going to be critical is bringing other parties to the table in terms of bringing in those community partners and those human services agencies, and what are their restrictions and rules, and what do the data sets need to look like from their perspective as well, right? So we all know about HIPAA and the restrictions around medical data being shared there, but there are those corresponding restrictions with whether it's SNAP data or TANF data or other program data, as well as state laws around a lot of those data. So how are we going to tackle those and bringing those other folks to the table? I don't know at this point that there is a standard model for how you approach that, but I think that those are exactly the kind of questions.
I think there are a number of competing standards that are out there. I mean, if we go to ACF, is there an ACF equivalent specifically around, HIPAA-like sharing? When MITA came out, the Medicaid Information Technology Architecture, a lot of other federal agencies, Food Nutrition Service came up with their own version of it. ACF worked on some of those types of things. What might be helpful, and maybe we can bring this to the storage exchange folks, is to create some sort of annotated bibliography or something like that, where you might be able to pull down a set of what we think the corresponding rules and regulations might be around consent and sharing across the various health and human services agencies, at least at the federal level, and then maybe try to draw that down to state.
Yeah.
Absolutely. And I believe that the Stewards of Change team, a few people are listening in today, so their ears are tuned up, I'm sure, for things that we can continue to do together. All right, so more to come on that. It's a great question. And then the next question, so just based on what you've shared, how are you approaching consent rules that are different across the states, as well as different data types, such as female reproductive health, especially considering the lack of data standardization and the nature of high-use health system local codes?
I think that because InterSystems isn't developing a product around this topic. Part of the engagement, some of the things that we would consider across the board as just sort of a member of the community is how do we localize these policies, right? And consent to share. And when Greg talked a little bit about the granularity around and some of the unique attributes to go through, I think that question is a great sort of example of the level of complexity that comes in, because we're going to see several different problem types that have to adequately get addressed. And I just saw something pop up about the food bank that came up. So a food bank might be using a certain standard. When we talk about reproductive rights, that's an entirely different set of standards. And we think globally about consent, right, across the health and human services continuum. When you're bringing forth clinical and non-clinical data and asking these types of questions, I really think we're at infancy is probably too strong of a word. But we're at a beginning where we're trying to look to resolve these problems. And part of the discussion today is to try to really get an understanding about where is that complexity in practice, because people around the table here, right, sort of our larger community, they're dealing with these things day to day, and they all have an individual lens about how they see it. The collection of that kind of stuff that we bring together is really going to help us figure out how to overall orchestrate it. And I would say that based upon what I've seen thus far, and maybe some folks from the Institute have a different point of view, I don't think there's a centralized point of view about how that's all going to execute.
Yeah, so Daniel did chat in just that, part of the Stewards of Change model is to create a national catalog of exactly these detailed regulations. And that's kind of the goal. I think, this is extremely nuanced. It is local. It's very specific. And there is a level of granularity that is absolutely required. So Daniel's also encouraging people to come to the session.
And some of this also goes back then to that data model, right? Of understanding that all of these systems have their own way of dealing with individuals and data that they collect, and sometimes their own very unique definitions. And that data model then to be able to translate in between those two and move the data becomes more critical.
Absolutely.
I think if we were an onion, we're probably at the point where we've peeled back the first couple of layers, and there's a lot to consider. What really drove me professionally around this is when I started this concept is when I started having conversations with people about things like food as medicine and what does that really mean from a social construct standpoint. Because by definition, we're bringing in the crying phase. That's awesome.
Yeah, I had the exact same thought.
How are we solving clinical problems with sort of social work and constructs and other things that come into play? And that makes life really challenging when you start to think about it, because this convergence really changes and moves all of our cheese, right? We thought about maybe interoperability as being this data moving back and forth about medical records. Now there's this other stuff that comes in. Lots of us are unfamiliar with it. Are the standards as mature? I would say probably not. Have they thought about it in the same way? Because, in an integrated standpoint, there was a child support system, there's a child care system, there's a child welfare system. And at one point, they were all just in individual buckets. And then policymakers started asking the questions, hey, are kids safer across all of this for the money we're spending? And it became a financial discussion. Then somebody said, well, the output's the same. And now they're asking outcomes questions. And the maturities even went up further, and they're saying, well, the collection of this kind of stuff, is somebody going to be healthier? Boy, that's a lot to think about. And we, Greg and I certainly aren't going to answer that on our own. We can barely get together the presentation to get the questions out.
We have a couple more questions I'm going to try to work in, and these we may need to take these, also to the consent management workshop where we're going to continue to partner and work through some of this. But There's a question that's a little more technical around how do we validate identity and security of people providing consent, as well as identity of requesting parties.
We have within Health and Human Services agencies, oftentimes at the point of intake, identities are validated with a collection of information, whether that's some sort of ID. Some states have undocumented, sort of considerations around that, with the birth certificates and light bills and things like that, or a copy of your lease to help demonstrate who you are. A lot of that gets on paper, and it's also in an unstructured fashion, right? So you might get it at the point of contact, but what do you do with that across the line of business? And does that threshold that maybe at the Human Services Agency or at the community center, does that meet muster to share clinical information back and forth? The answer is probably not.
Right. Well, and it may be a case where I can give consent for purposes A through C, but D, E, and F, I need to provide you more information to validate my identity, or I can give conditional approval for those higher levels of information, but the program or agency or some utility is going to have to go out and validate my identity. On the flip side, most programs or agencies, I believe, that are receiving sensitive information have some sort of role-based access control built into their systems. That may need to evolve and become more robust as they start receiving additional information from other purposes, right? If you're going to see this information, and that becomes part of that gatekeeping function, right? Of it's one thing for me to say somebody's involved in my program. It's another thing for me to say, and by the way, here's all their eligibility data, their financial data that I'm sharing now with the community agency that I don't know who has access to their data system and their controls that they have around that.
Maybe one more.
Right. One more. All right. Do you see a path for a federated consent model, or must there be a source central registry that is updated?
I think you could have a federated model in place. We've kicked around whether there's going to be a sort of a centralized utility or not. I think a lot of that's going to depend on source system capability, the enterprise's capability to centralize the concept. There's also some risk factors that come into play. Been able to federate and manage lots of other sensitive stuff in the past. I think we could probably get there here as well. But in every use case, it might not make sense. It might be cheaper, faster, better to centralize, and there might be good conditions for that. It's just like when we work with states, if you've seen one state, you've seen one state.
Yeah. All right. Well, thanks for weighing in on that. Greg, any final thoughts before we wrap up?
No, we really appreciate the opportunity to chat with everyone today. And there's some great questions that we look to follow up with folks about and continue this discussion in Detroit.
All right. Well, thank you so much. This was really great today. Appreciate you sharing your expertise and also the questions that came in. It's just great to have so many engaged people listening in. We look forward to seeing you in Detroit in 1 month. And if you haven't registered for the conference, please do. All right. Thank you so much. Take care.
Thank you very
Bye.
much. Bye now.